So now some final words about treating the obesity and its benefits. So the as far as the key components of the weight reductions are concerned, uh, decrease in energy through the dietary changes. I mean, you have to change your diet. That's the far most important thing. Then you have to increase the physical activity, and then there should be behavioral modifications also. Behavioral modification mean your way of eating, your timing of eating, and your way of living generally. For instance, how much physical activity you do, how much you sleep, how much you sit, and etc. Then there can also be, we can also uh, think about additional interventions like the medications or surgery. Of course, there is always challenge. Losing weight is not an easiest of thing. It has to be, you have to be very committed to your cause to remain to lose your weight. Then you have to be very vigilant, and there is, we always see people lose the weight and they gain again, and when they gain with some more propensity, with some more intensity. As far as good diet is concerned, of course, that is the far most important thing. It's not only that how much you eat, very important, that how much calories you have to think about, how much calories you are taking. So that when you are talking about calories, then you have to think what you are eating. We know that the carb food, the carbohydrate full food, the junk food, the KFCs, the McDonald's, they contains a lot of calories, and of course the cokes, the drinks, the soda drinks, they also takes involve lots of uh, calories. Then also you have to think about the long term effectiveness. Look at this stat: 90, more than 90% of the people who, because of exercises, because of diet specifically, who lose their weight tremendously and they then regain their weight with a very short period of time. And the, if you take healthy food and you somehow manage to reduce your weight, the benefits are absolutely tremendous. 10% of weight loss, if you can lose weight within the passage of 6 months, it can reduce your blood pressure tremendously. It can improve your lipid levels. Of course, that will be improve your cardiovascular health in return. And of course, your diabetes can be controlled. So that is, if you see the benefits, then no matter how difficult it is, you cannot say that it will go useless. Then physical activity, of course, we have to change our lifestyle. It's not all the time about eating less. It's also about how much work you do, how much physically you are active. It leads not only to, I mean, your reduction in weight so that your body looks better. It also, of course, the most important thing is that your cardiovascular health is also improved. So the best way to decrease your weight is to do it in combination. Both you should reduce the calorie intake and you should also do the physical activity. When you combine the both, that will be the best strategy to enhance the loss of your weight. Of course, we know that sometimes it's not all about your behavioral habits or not all about your and how much you eat. It's also some other factors are involved in the obesity, and the medication is also one of the option. But keep in mind that this is not the best option. This is only, you should go towards medications when other things like decrease in the caloric intake or the increase in the physical activity, if that is not helping, then you can also take the medication like orlistat, lorcaserin, phentermine, and topiramate, liraglutide, bupropion with naltrexone. All these drugs, all these medications help in the reduction of weight to some extent. They are modest in their effects. They are not very acute in their effect. They don't affect strongly, and that's good for your health. I mean, you don't have to use very highly potent medications for the reduction of your weight. They reduce your weight modestly, but again, keep in mind, they are not a permanent solution, and this is not a very healthy solution either. So you should only use when it is really advised by the doctor. Then, of course, you can also use the option of surgery if you really is facing a very uh, emergency situation where it is indispensable to do. You can do the gastric bypass, which somehow will lead to the reduction on your weight. You can also cut certain parts of your gastrointestinal system so that the storage of the food is minimized, but that is also done in a way that it doesn't compromise the health of your body. And then there is also the lesser invasive way of doing it. That you can stimulate your vagus nerve. The vagus nerve is involved in controlling your appetite. So if you somehow manage to stimulate the vagus nerve, it will decrease the appetite, which will eventually lead to lesser intake of the food, which will ultimately lead to reduction in the weight. So again, these are the methods, these are the approaches which should only be done when all the other approaches, which are more manageable approaches, which are not possible, then you have to do comes towards the surgeries or medications.